You see, the practices that are losing patients are losing them to the practices that are able to do these three things well. And when you practice efficiently, you also practice profitably. One of the things that makes profitability much, much easier is to have impeccable systems that run everything that you do. See, systems are what run the practice, people run the systems. How many of you like to go to Starbucks for coffee? Okay. Do you ever notice who works in Starbucks? There's usually a high school senior, college freshman, 18-year-old taking your order, and then there is another 18-year-old making the beverages. They never speak to one another, and there are 82,000 permutations of Starbucks beverages. If you consider the lattes, the macchiatos, the skim, half skim, whole milk, half decaffeinated, full decaffeinated, 82,000 permutations. Two 18-year-olds never talk to one another, and they rarely make a mistake because they have an incredible system that involves 6 boxes on the side of their cups. And they code in those 6 boxes on the cup, and that's what gives them the system to which they are able to produce these beverages efficiently. It works certainly for McDonald's as well. Wherever you go in the world, McDonald's is just about the same. So let's take a scenario that we have 4 members of a dental team who go in on a Powerball ticket today for the weekend drawing. And we know that the hygienist knows everything about every patient who comes in, where each person has a sensitive spot, that they have to be really careful with the lower second molar, that they don't like the Cavitron used on their front teeth. But where is that information for her? It's in her head. And the administrative person in the practice, she knows the reasons why everybody makes their appointments at certain times and needs certain days, and she knows why people have certain patterns to their payments, and she knows what's going on in everybody's lives, and she knows about relationships in the practice. And where is all that information? It's in her head. And in most practices, if you ask the dental assistant, she knows what the doctor is thinking before he does. She knows where all the supplies are. She knows all about inventory. She knows what he's going to need and what he's going to use. And where is that information? It's in her head. But if these team members go out and they buy the Powerball ticket for this weekend and they win $94 million, which is the prize, do you think they're coming back on Monday morning? Maybe to pick up their things, but in most of our practices, I don't think they'll be returning. And when they leave, what leaves with them? All the systems that they have in their head that have not been transcribed and written down so that other people can run the systems. So it's important to document the systems and the job descriptions and how we go about doing things and how we turn on lights and suctions and compressors so that anyone coming in has the ability to help the practice run efficiently. I went through a period where 5 members of my team were all giving birth in the same month. It was 9 months after our holiday party, and though I don't take any credit for these, I do think I put them in a good mood back in December. But the bottom line is our practice was still able to run very efficiently during the last quarter of that year because we have a very, very defined manual for systems and operations for every single role in the office.